the fire health screen review, fantastic. The fire health screen review, fantastic. Because even as an ex-serving member, I got a little bit upset with myself. I'd done something, and luckily these guys were around and about at the station. I was able to come round, talk to them, friendly faces, and calm myself down and get my emotions under control.
I know it. Just take a breath in, a really long breath out. Nice breath in, nice big full breath in, and a real long breath out. You know, yeah. You know, when that heart rate will lower. Those symptoms will pass.
And then go back round home to my wife and just be my normal self.
The process you're going through, and you know, you're recovering. You have been recovering. You will continue to recover over time, and you got to be easy on yourself.
Did you take a stroke?
It was a stroke, wasn't it, Mike?
Yeah, it was a stroke. It was a stroke, and
heart valve.
Yeah, the long and the short of it is, we want to try and promote general good health and well-being to everybody. And in South Staffordshire, it's identified actually that there are more health risks in this part of the county than there are actually fire risks. But when we look at the evidence, fire death risks and obviously, you know, deaths from health and poor health are often the same thing. They're intertwined and interrelated. So what we're doing in the fire service is, like all other, but particularly in Staffordshire, we want to take it a little bit of a step further, and because of all the homes that we go into for home fire safety checks, the sheer amount of vulnerable people that we can come across, we want to identify people that may be at risk of health problems as well as general health and well-being issues, and we want to sort of play our part in reducing hospital admissions, winter pressures and that sort of thing. So what happened to Steve was he had an infection in his tuff, and it actually led to the bacteria travelling in his bloodstream to his heart, where one of his valves got infected.
Mitral valve.
The mitral valve in the heart, that's correct. And it caused him to have a stroke, and obviously that's caused him a lot of problems. He was in intensive care for a while. He had a lot of recovery, and he's got to a very good place now. And the whole point of that is, you know, if we were doing health screens and we were identifying problems in people's homes when we go and visit them, you know, if we do health screens like we were going to once a month at, say, the Jubilee Hall in Brewood, or even potentially at the fire station sometimes, we may spot a problem with somebody older, or maybe somebody not that old, where we can prevent it from being a problem. We can maybe refer them to their GP. You know, we can identify risk factors earlier on, and obviously we're making safe. Staffordshire's motto is to make Staffordshire the safest place to be, but the future now is working in collaboration with our NHS. You know, we've signed up to with Public Health England and NHS UK to reduce winter pressures and hospital admissions, and a great way to do that is the safe and well checks, the HFRC process, and by us engaging with our communities even more than we've ever done it before, to make people safe and get them the help they might need, and, you know, as I call them, red flag warning indicators earlier on, to prevent them being a problem further down the line. And that's really what it's about.